Tell me one, two, out. Good afternoon. I am Dr. Georgi Abraham from Chennai, the incoming president of the Indian Society of Transplantation. I have been a practicing nephrologist for the last 42 years, starting my nephrology career at CMC Hospital, Vellore in 1980. And I am happy to be here at the Isot meeting conducted by Nagpur nephrologists and urologists and transplant surgeons, the 32nd annual conference of the Indian Society of Transplantation. I have seen the Indian Society of Transplantation from its infancy, and now we have outperformed many developed and developing countries in terms of transplantation and the outcome of transplantation for our patients. And I am very happy that it is a very successful meeting covering a diverse transplantation of organs and also including composite tissue. There are unmet challenges for us in transplantation in India. These unmet challenges require solutions, and we have to look at that in a very critical way. These unmet challenges are: one is deceased donor transplantation. Although Tamil Nadu is in the forefront of deceased organ donation, up till now, in spite of the third wave of COVID, we had 115 organs, 115 donors who has donated the organs compared to last year and the year before last. So the society did very well under the presidency of Dr. Sunil Shroff, who is a colleague of mine for the last 2.5 decades, and I am stepping into his shoes to be the president of the Indian Society of Transplantation. The unmet needs are in terms of transplant immunology. We have pockets of transplant immunology in major cities in the country, and we need to expand them to the other parts of the country so that we will have easy access to transplant immunology when there is a need. The number two is the infections. Infections take a major toll of our transplant patients, and these infections have to be diagnosed early and they have to be treated for a better outcome. So the infections have to be looked at. These infections are different from developed countries, Africa, and in other parts of the world. So we need to focus on infections in our country, such as tuberculosis, gastroenteritis, malaria, and so on, which are common in our country, and these infections may take a toll on our transplant patient. Now the COVID-19 pandemic has taken a toll of a lot of our patients, but the last wave, which is here now, we learned a lot of lessons, so our patients are living. The third one is biopsies and histology. We have an issue with organ biopsies and making a diagnosis of rejection or infection or something else in the organs we transplant. So this challenge also have to be met, and we have excellent pathologists in our country who have great knowledge of kidney, heart, lung, liver, pancreas, intestine, composite tissue, and corneal transplantation for that matter. And they have to come together under one banner and a core group to help us support in our transplant outcome. So the next thing is that training of our youngsters, because lot of our youngsters who are superb in their knowledge and training needs to be brought into the mainstream, and they should in future take care of our country and upscale our programs. And so I wish all the best for the delegates who are attending. I am sure that I will see you next year in Calcutta, and we will have a better meeting. And also I would like to mention that 3 of our Indians have outshined the whole world, including Dr. Manikam Sudhandaran, who is the recipient of the Medavar Award, and Dr. Vivek Kutte, who is the recipient of the Transplantation Award, and Dr. Gomati Narasimhan, who is also the Women in Transplantation recipient by the TTS. I look forward to more awards for our youngsters, and thank you.